survey and want to participate. So they'll be making those phone calls to contact them for future surveys. We're going to plan a food gathering in August. Maybe we might be able to do 2. So we'll have food gatherings, and that group will help to plan that. And it will depend on what's happening in terms of the variant. We'll let them decide if they want to meet live or if they want to meet virtually. And so we're excited about what's happening. I'm excited because it's easy to work with people who really want to see a difference in their community. Had opportunity to talk with some open air, one guy here in Orangeburg, who he's the only one I think that actually has established open air market. And so he's willing to be a part of the council. Once they understand that they'll have a voice, it's been real easy to get people on board and involved. So that's been our first step, is to really build relationships and get the people that we're trying to make a difference for engaged and involved. And so I see that Ms. Harrison and Phil are on. So if they have anything they want to add, they can kind of chime in. And if any of you have questions, feel free to ask.
Thanks, Deb. Thanks so much for giving that overview. That's really exciting work. Stephanie, did you have anything you wanted to add?
I'm sure that Deborah has covered it. She has just hit the ground running and been doing an outstanding job to ensure that we can address some of the food access issues that we have here. The ground is really being cultivated in all 3 counties, and we're just excited, and we're thankful for the opportunity.
Thank you. All right, and Deb, sorry for the interruption with I forgot to press record at the beginning of the meeting. So
it's quite all right.
All right, so next up we have Department of Agriculture update from Laura Kate.
Hey, good morning, everyone. I'm filling in for Kyle because she is on vacation this week. So what's going on at the Department of Ag? We've recently announced a new grant, a packaging grant, where we're helping growers reimburse the cost for packaging needs. We've seen that throughout COVID, those prices have gotten really expensive in terms of cardboard, pallets, all that sort of things. So we want to help alleviate some of those costs. So we got a grant through the Specialty Crop Block Grant. So that one was just released. And we still do have our CoolBot and water testing as well. The market development team, we are working on identifying some growers who could potentially expand to meet the supply need. Along with COVID, some supply has been hit. So we're trying to help growers meet that demand. In general news, we did receive some extra COVID funds. So we held a listening call last week for growers to contribute their thoughts. It was good for our first one. We're thinking about maybe doing another format in the future where people can submit comments online. July in South Carolina is a very busy month for growers. So it's hard to get people on the phone for 2 hours. So in the future, we'll have another one and maybe do it online instead. But we still got some really great feedback addressing food access, food hubs, that kind of things. And we're working on figuring out a way that we could use that money towards those issues. One thing that we are definitely going to address is the shortage of meat processors in South Carolina. They're very few and far between here. And we know that's just been even made worse during COVID, and times have been backed up to get meat processed. So we are looking at ways we can address those needs as well, and putting a plan together. But those are the major things going on, trying to just figure out the best way to use this extra money to go back directly to our farmers.
Thanks, Laura Kate. Any questions for Laura Kate? So next up, we have some policy and advocacy updates. So first up is Sarah from South Carolina Appleseed Legal Justice Center, and she'll be filling you in on the details of this, but we especially wanted Sarah to come and talk to us today about work that they have been doing over the past months and report that they developed that the Food Policy Council Board voted to sign on to, but around opportunities and recommendations for strengthening SNAP in South Carolina. So Sarah, thanks so much for joining us today.
Thanks for having me, Carrie. And Carrie, thank you for all your help in getting this report together. So as y'all know, my name is Sarah Bailey. I am a staff attorney and policy analyst for South Carolina Appleseed. I'm going to see if I can share my screen, and I made a PowerPoint kind of going through our report and sort of what we covered. This report is on closing the SNAP gap in South Carolina. So to begin with, obviously, I want to kind of cover the benefits of the SNAP program and how it works to help South Carolinians come out of poverty. SNAP feeds South Carolina families every year. It helps about 14% of South Carolina households with children and 11% of South Carolina households overall, and helps them to achieve a higher level of food security. In addition, the program has increased during the coronavirus pandemic to help about over 600,000 individuals and over 280,000 households every month. At one point in March of 2020, it was at 298,000 and some change households. So it has had a huge impact, and it's been really instrumental helping keep families out of poverty and helping low-income families access food during the pandemic. On the whole, 45% of SNAP recipients in South Carolina are children. So I also wanted to provide a little bit more background information about how SNAP helps families emerge from poverty and helps keep them out of poverty. As I mentioned before, nearly half of the recipients of SNAP in South Carolina are children. If you add into it people with disabilities and elderly individuals, that's a high majority of South Carolinians. On average, American households only stay on SNAP for about 8 to 10 months, but it's a highly effective way to help people move from food insecurity into food security. This can have a ripple effect in the economy. Not only does it help children and individuals to improve their physical health, help children stay in school and perform better when they're in school, but every dollar that goes into SNAP in the United States, for every federal dollar that goes into SNAP in South Carolina, it will actually generate between $1.50 and $1.80 into the local economy. And it ripples throughout the entire food system. So it doesn't just help the individual who it's feeding, it helps the food producers, suppliers, truckers, and the entire food industry. It can have a really big effect in helping to boost the state's economy as a whole. I wanted to cover briefly what some of the barriers to food security are. Some of these we were able to advocate for resolving in the report, but because we were not allowed to advocate for legislative changes, some of them we were not able to specifically talk about solutions for, but we did address. One of the big issues across the board is systemic racism. In the last 2 decades, Black and Latinx households have been twice as likely to experience food insecurity. I included this graph to show that there's a comparatively very high rate of Black and Hispanic South Carolinians living in poverty compared to white South Carolinians. During the pandemic, this became even more stark as Black workers are nearly twice as likely as white workers to be laid off or to find themselves otherwise unemployed. Now, another one of the issues, an administrative issue that we run into in terms of SNAP access is the income limitation, which is that SNAP households can only receive SNAP benefits if their income is below 130% of the federal poverty level. This is something that could actually be solved on an administrative level by DSS. They could essentially unilaterally raise that gross income limit to 160% or 200%. That's something that the state can do without any legislative changes. Other states that have made this change have found that it increases access among all eligible residents. It bolsters the state economy and it increases food security across entire communities, helps to combat the kind of problems that we see in food deserts. In addition, and another major barrier to SNAP access is the drug felon ban. Individuals who've been convicted of drug felonies in South Carolina are not allowed to access SNAP benefits. They're categorically ineligible to receive SNAP benefits, regardless of the nature of the drug felony, how long ago it was, outside mitigating factors. There's absolutely no way to compromise on that. The drug felon ban was actually initially implemented during the war on drugs as a federal ban, but South Carolina is the only one to have it in full effect on a state level. This is something that Congress is working on a federal level to address and potentially lift. But on a state level, South Carolina can and should also make efforts to lift the ban. So in our project, we found that the emergency allotments were crucial in terms of providing necessary aid to families in need during the pandemic. These emergency allotments allowed all SNAP eligible households to receive the maximum SNAP benefit amount regardless of their income level. So even if you're making an income that would be over 100% of the federal poverty line, you would get the full amount. It wouldn't be prorated based on your income. Having this extra money allowed recipients to have better access to nutritious meals. They were able to spend less per meal by buying food ingredients in bulk instead of having to buy the smallest package of every item, every ingredient. A lot of them also reported being able to eat for a full month and still being able to afford some of their overhead costs and not having to weigh whether they were going to eat or pay the power bill. For many of them, it also provided immediate short-term economic support when they found themselves jobless. And they also found that having access to the online purchasing pilot and being able to use EBT online allowed them to continue to practice social distancing and get food throughout the month. Another big issue that we ran into was the benefits cliff. A lot of the people who we spoke to throughout the course of preparing the report talked about how a small pay raise, in one case a $4 raise in Social Security, caused them to become categorically ineligible for public benefits. One person we spoke to talked about turning down a promotion because the pay raise wouldn't compensate for the lost benefits and would actually cause her to have less money and fewer resources to feed and provide for her family. So we talked to some stakeholders across the state, and here are some of the ideas that they've set forth for ways to make the program better in South Carolina. One was to increase the benefit amount, and that would just be paying people an amount that would be closer to what they were getting during the emergency allotment period, which is coming to a close. Another would be to increase the maximum income that would allow them to be eligible. And this would reduce the effects of the benefits cliff. Another big problem people talked about was having issues communicating with DSS. And so one of the things that would be really great in terms of making the program better would be to streamline communications between recipients and DSS, and to facilitate communications between individuals and their caseworkers. In addition, people talked about struggling to upload or send in the necessary documents to receive benefits. And so streamlining the application process could be a big help as well. The last thing that people talked about was the stigma and misinformation that they were receiving about SNAP. And so taking efforts to decrease the stigma and misinformation could make a big difference. So I've put together a little list of next steps as well. One of them is that our report should be published in the next couple of days. It has gone off to the designer, and I think we're just waiting for the final approval to distribute it. Once you get it, please review it and share it with other people and partner organizations that you think might be able to implement our suggestions and ideas, or advocate for the changes that we need in order to make the program better and more successful. Another is to collaborate with partner organizations, just like in meetings like this one, and talk about food benefits and how to increase access to food benefits. Finally, sharing information about SNAP within the community, that can be through social media, posts, public service announcements, and things like that, that can increase participation and reduce the stigma for people who may benefit from SNAP, would help to reduce the number of South Carolinians who are eligible, but for one reason or another choose not to participate. Also, I wanted to do a little plugs. South Carolina Appleseed has just started a monthly hunger benefits advocacy coalition. If you're interested in learning more about the issues of hunger benefits, streamlining EBT for your business, and promoting participation in SNAP and related programs, please feel free to give me an email and I'll add you to our list if you're interested. And then finally, I wanted to end with this little announcement. The emergency allotments, which allow individuals to receive a higher amount of benefit for their household size, actually are going to end on August 1st because the state of emergency was lifted. Here's a statement that our organization has put together explaining the situation and how we got here. Please feel free to share this information that the emergency allotments are ending with your community, because it's extremely important that people are not blindsided on August 1st when their benefit amounts are less than they might otherwise expect. So thank you all so much for letting me come and speak about this stuff. Let's see if I can stop.
Thanks, Sarah. Thank you for all of that. Any questions or comments for Sarah? All right, then next up is Phil Ford.
Hey y'all, how's it going? I'm Phil Ford. I use he and him pronouns. As I was referenced to earlier by my friend Deb, I wear lots of hats, but right now I am going to be talking to you as the policy and advocacy consultant for Wholespire, which was formerly known as Eat Smart, Move More South Carolina. You may be more familiar with that name, but we're an organization that advocates for policy systems and environmental changes that lead to positive health outcomes in communities at the state and local level mainly, but we'll partner with our friends at FRAC and Feeding America and Appleseed when we get to go to DC for the Anti-Hunger Policy Conference, typically every March. But thank you for having me. As my sister from another mister, Sarah, good friend, just mentioned about the Food Insecurity Coalition, Eat Smart, Move More, or Wholespire now, was doing that through the end of the pandemic last year, the end of the year during the pandemic last year. And we're going to kind of pool resources with them and share their meetings with our lists. But this year we've spent a lot of time with legislators and decision makers at state agencies, building relationships so we can have direct lines to those folks making decisions regarding healthy food access. We have reached out to the governor's office regarding what Sarah just referenced with the emergency allotment ending on August 1st. We'll hopefully have some information to share soon. We've also been working with the legislature to pass 2 bills from one chamber, the House of Representatives, to the Senate. The first is House Bill 3006. That is a bill that will prohibit school districts from using debt collectors to collect school lunch debt. That often puts additional fees, interest, and can sometimes double that debt for families. That received a favorable report from the House Education Committee, where we testified and passed the full House, and is now in the Senate Education Committee. At this point, there has not been a subcommittee hearing scheduled, but come November, December, we'll be pushing our advocates and our friends to reach out to Senator Hembry and the Education Committee in the Senate to go ahead and schedule a subcommittee hearing on that bill. The next bill that we're happy to report that passed the House is House Bill 3319, which would not allow students to go into debt, school lunch debt, and would not allow schools to use punitive measures, such as not allowing a student to walk at graduation or taking away their recess that we have seen in some school districts across the state if they do have school lunch debt. We're really proud of that, passing the House unanimously. We had over 100 advocates take action during that process. That bill also currently sits in the Senate Education Committee, so hopefully we can have a twofer subcommittee hearing when they get back in January, and we will be asking our advocates again to take action to push for a subcommittee hearing. Additionally, we are getting ready to unveil, if you will, an Advocacy Academy for our members and our partners. We are in the process of doing this with our very first group, but it's a three class series. The first being Advocacy 101, kind of talking about how it works, the effective methods, when to do what, basically. The second will be Government 101, basically your legislative process, knowing the difference between your federal, state, and local governments and what they have control over. And then the third is really building relationships with the decision makers and not always yelling at them if they do the wrong thing, because no one likes that sort of interaction, but making sure that they hear from us even when things are going well. So that's pretty much my update from Wholespire. I'm happy to entertain any questions or comments, concerns.
Thanks, Phil. Thanks so much. All right, so our next up for policy and advocacy updates is Matt from Carolina Farm Stewardship Association.
Hey, everybody, this is Matt Nace with CFSA. I'll give you a quick policy update in the world of local food systems and sustainable agriculture here. There's more than $1 billion in COVID relief money sitting with the Department of Administration, just waiting to be used by the governor, not exclusively for agriculture, but we are pushing hard for around $500,000 of that to go towards various food hubs throughout the state to kind of provide a stronger backbone for local purchasing for small farms and small producers. There's also a push for infrastructure grants to expand and build out livestock processing facilities throughout the state. I know Laura Kate mentioned a little earlier about. So we're curious to see where that goes. It's kind of a hurry up and wait process. One other thing we'd like to mention, for those who've been around in this industry for quite a while, you may be familiar with the concept of the Farm Bill. The Farm Bill is a process, happens about every 5 years or so. It's a package of legislation on the federal level that provides basically the most consequential policy priorities for agriculture on every scale, from crop insurance to healthy food access, for low-income families, beginner farmer training, and there is just now beginning in Washington, here in South Carolina a little bit, the beginning of a push about this, what's going to be included in the next Farm Bill. It's not supposed to happen until 2023, but the push begins, a good year or two in advance. So we will be reaching out to many of you on this call to kind of host some listening sessions and community meetings to get a sense from our advocacy partners what their needs are and to bolster that corner of the local food system. Next up, child nutrition reauthorization. It's a process which Congress updates all of the laws that governs pretty much all of the child nutrition programs, including school lunch and breakfast. That usually occurs about every 5 years or so. The last time Congress reauthorized that was back in 2010. So an update on that front we're following is there's 4 marker bills that build off the existing farm to school grant program. Right now, CFSA is beginning a grassroots push to hopefully get those rolled into one larger bill that would either become and be included in the next child nutrition reauthorization package, or it would be included in the next farm bill. So I'm sure many of you all are familiar with, if not those marker bills, then definitely the child nutrition reauthorization kind of process and what's involved in that. And so we're currently working on that as well. There's some smaller legislative stuff on the state level that we're working on. As Phil kind of mentioned, the legislature's done for the year. If anybody has any specific questions about what the next steps are on some of our state efforts in terms of the legislature, we've got some time on that. Again, we'll be making a push in November, December on things like cottage law expansions and things like that. And then I know that there's also some exciting work happening with the local food network grant. CFSA is involved with that, as are many of you on this call. I'll definitely let Nikki discuss that a little later on. So if anybody has any questions about any of that, just let me know.
Thanks, Matt. Any questions for Matt? All right. Alyssa was not able to be on in time on this call she wanted to talk a little bit about some advocacy opportunities with the American Planning Association. But we will move on to the next couple agenda items. So Nikki is going to now talk about the local food network grant that Matt just referenced. And Nikki, I'm not seeing Ken on, so when you're done with that, you can just segue into the next agenda item.
Okay, sounds good. Let me just get the right tab up. Hope everyone is having a great afternoon. Going to share my screen really quick here. All right, so this is in Google Drive, so bear with me while I present this. Hopefully everyone seeing a full screen. All right, I'm going to go through this pretty briefly. If you would like more information, I'm happy to send you a more detailed overview. But essentially, we currently worked with a number of organizations to submit a grant through the USDA Regional Food System Partnership request for applicants to fund a statewide local food network. And really, this is about bringing together all the organizations serving local food systems in South Carolina to increase collaboration and build off of some of the work to date. A lot of this was spurred by the success of the South Carolina Food Hub Network, and we saw the power of bringing folks together that, maybe even sometimes are in competition with each other, but finding ways for collaboration and cooperation to better serve our food system and our farmers. So I've got the kind of the generic community food system graphic here, and it kind of shows how, each of those components kind of breaks out further into other networks. So right now, we do have a statewide food hub network, but that is super hyper focused. And obviously we are on the South Carolina Food Policy Council call. And so, how can we build off of the work of the South Carolina Food Policy Council, as well as the work of this South Carolina Food Hub Network? So I'm going to skip some of this because I don't need to preach to the choir. I think a lot of you guys understand and appreciate working together collaboratively at a state level. What we're looking for here is increased collaboration and also kind of broader state level support. And obviously policy change is a key component of that, and having representation at that state level. When we looked out into the national kind of landscape, we saw a really successful case study in the Farm to Institution New England. They do have a network that is built off of what had been a very similar food council at a state level. This organization is actually a multi-state collaboration. And so they're bringing folks together to understand how there are intersections and shared practices and potential collaboration. So we interviewed a number of different networks to provide a concept. And we also really had been toying with this idea for over a year, around 2019. And then as we came into COVID, we very quickly realized the power of a network through the South Carolina Food Hub Network. And I think that really demonstrated to maybe some of the skeptics that maybe we're not sure if we really needed a statewide organization just for local food, that just by having the Food Hub Network, we were able to bring in over $10 million in federal funding, because we were able to very quickly understand the requests for applicants, get technical assistance, bring folks together for collaborative applications, figure out who needed what, where, and when for logistics and volume, and help pivot so these farmers who normally sell to restaurants could then distribute into food boxes for folks that really needed it. So again, this created a good incentive. It also demonstrated the power of the network. And this was kind of the case for support that we brought to the Department of Agriculture in a request for them to provide match funding so we could apply for a federal grant. So the Department of Ag did provide $120,000 in match funding for a 3-year project, with the project total ends up being a little over $600,000 at the end of our application process because of additional in-kind. Through this process, what is a statewide network going to focus on? Well, that remains to be seen as far as what the membership is interested in, but we know to date, these were some of the key areas that had been consistently brought up as areas of importance. So those were baked into the grant proposal itself. What does this look like in real life? This was an example we made of what if there was increased communication and collaboration on something as simple as a farmer training on high tunnels. So this just kind of shows you how many agencies could be engaged and involved in coming together to host trainings on high tunnel production, instead of having multiple disjointed, or not necessarily disjointed, but non-connected trainings. This allows for a farmer to know they're getting a one-stop shop. So we would like people to have that experience across the food system. So if you're attending a meeting, you don't have to go to 6 more meetings to get all the different elements of the food system covered. So it's the hope is that it increases and streamlines opportunities like this for increased collaboration. So in the grant document itself, what we're looking for is this overview to formalize this cross-sector food system network, really strengthening the food system. And at the heart of that, it would be creating an annual plan that's trying to determine what are the priority areas of need. And at the heart of that plan is trying to address the systemic inequities in the food system. We recognize in South Carolina, farm loss is going to, and not just in the state, but nationally, farmland loss is going to be one of the #1 issues facing farmers. So that being a key area, and also just making sure that we are increasing capacity for organizations in their existing work. So the first objective, again, creating this network, bringing folks together, making sure everyone that wants to participate is participating. Again, really focusing on the inclusive and stakeholder-driven input approach, and strengthening capacity through the continued work of the Food Hub Network. So all of this comes together under these activities. So this is a multi-partner grant The fiscal agent and primary applicant on this grant was Holspire, formerly Eat Smart Move More. It would be governed by the South Carolina Food Policy Council, which includes you all as members. And the idea is that this should be stakeholder and member driven. So we want that governance to be across all of the spectrums of the food system. We included project management activities and evaluation conducted by project managers, as well as these roles by individual organizations. So each of these folks submitted letters of support, letters of intent, budgets as necessary. Funding for this project gets split into a number of groups. We've got funding support for Rural Resource Coalition, really looking to bolster their existing annual meeting, as well as their annual conference under the South Carolina Association for Community Economic Development. So using those two gatherings as a place where we can bring folks together to surface what the key issues are in the food system. We would love to continue to provide support for Benita Clemens to conduct outreach to African-American communities, especially in the food system. We've identified Alianza Latina of the Midlands as a key catalyst builder for bringing together the Latina communities in South Carolina to understand and address challenges for those specific communities. And Rural Resource Coalition is willing to bring together and facilitate bringing together Indigenous communities. And South Carolina Food Hub Network continuing its work, as well as SC State Small Business Development Center and Carolina Farm Stewardship Association also agreed to continue to provide the really, really essential technical assistance that they're providing to farmers. So again, I know this is a lot, but we wanted you all to know that there is intent and there has been an application submitted to create this statewide network. It would involve annual meetings. It would involve input sessions. And it does have funding for professional development and technical assistance. So the hope is that this grant can help all of us, whatever your role is in the food system, better understand what's going on in South Carolina and where your organization could play a role. So that's a statewide network. I will pause the share and get over to the additional resources that were mentioned. So if anyone has any questions, you're welcome to post them in the chat. Of course, I have lost my tab. This always happens whenever I share my screen on Google Slides for some reason.
Nikki, you might have mentioned this, but when do we find out about that grant?
Yeah, so they had a hard time finding enough reviewers. So I think there's going to be a slight delay, but the release of funds is supposed to happen in October. So we're looking for this fall.
Thank you.
Yeah. So yeah, just huge thank you to like everybody. This was a huge push by a lot of people to be able to get all of this together. And we really are hoping we can get some additional funding into South Carolina like this. And one of the goals of the group is to increase the amount of federal funding coming into our state. And we feel like having some facilitated connections is going to be crucial to that. Okay, so this is real informal. And this is going to be just a 2-minute plug to essentially stay tuned. What we wanted to do is let you all know that the Food Policy Council itself is in the process of doing racial equity assessments. We're really committed to evaluating ourselves individually, organizationally, and as a group. And we want to share that process with you all, as well as share other resources. So this was just kind of an email exchange from several of us. Number one, saying, look, there are great resources in our own state that already exist. So there, you may not realize that some of these organizations have these incredible databases and equity action starter kit, and there's training series happening. And again, there's training resources that are just in general. And then there's also some specific coalition-based resources if you're operating a coalition. So this is a list I'm happy to share with the entire group. This is just like I said, a super preliminary brain dump here. And just recognizing there's some groups that are doing, I don't know why this is not automatically opening, some great work in South Carolina to further the action and advocacy in food systems, and having some really honest and open and hard conversations about the history of food systems in South Carolina. You know, we do have a really, you know, unfortunately dark history, especially for many of the communities in our state. So it's good to understand that and know what's being done. So a group that's really out there trying to get some key data, as well as having really hard conversations about what are people doing to support Black farmers in South Carolina, is the South Carolina Black Farmers Coalition. So again, some really good resources out there, organizations that are doing work if you're not aware of them already. So I will send these out to you all. If your group is doing something or has a resource, please share. I have a whole other document that's just national resources. We wanted to really highlight South Carolina. I have some articles that just talk about the history of Indigenous groups in South Carolina, the history of Latina communities, and some of those injustices. Ken from Rural Resource Coalition did kind of his, you know, top articles that he would recommend for folks just to have some conversations. The Rural Resource Coalition currently is hosting a cohort of groups and individuals to go through a racial equity action learning process that I'm thankfully a part of. There is also a fellowship through Furman that does racial equity training. So if this is something you're interested in, you're welcome to email me. I'm happy to share. There's some policy-based resources. Carrie shared one about metrics in the food system. And then I just want to share with you all, this is the initial stages of the proposed process for the Food Policy Council. So going through a self-assessment to understand kind of what's the baseline, where are we at, where do we have challenges, watching some videos, reading some articles. I did recommend to folks that High on the Hog is on Netflix right now, and it does feature some South Carolina producers and stories. So, you know, add that to the watch list. And if you're working in funding, I do recommend taking a look at this open letter that was written from BIPOC leaders to the food system. It's a really raw and honest conversation about white saviorism and power structures in the food system. So these are all here. I will share this with you all again. Please don't judge the super rough draft vibes here, but thank you for your time, and I will hand over the torch.
Thanks, Nikki. And we can also get these resources on our the South Carolina Food Policy Council website. So we'll do that soon. And if anybody has any additional resources that they want to see included, you can send those to Nikki or to me. Thanks so much, Nikki. Any questions for Nikki before we move on? Okay. So next, we just wanted to have a little space, definitely in the agenda, to open it up for anybody who has any updates or announcements that you would like to share with the group. All right, hearing none, then we will move into the next part of our agenda. So later on in just a little bit, Nikki and Brian are going to be facilitating initial conversation around conceptualizing a committee structure for the Food Policy Council. This is something for those of you that were able to join for our first ever quarterly membership meeting, that when towards the end of that meeting, we did some breakout sessions. And one of the things that we asked the small groups to talk about was if people thought that it would be useful, helpful, valuable to have committees operate out of the South Carolina Food Policy Council. And the consensus on that was yes. So we want to revisit that idea and talk a bit more in detail about that. But in the meantime, we have actually created one committee out of the council already that I know some of you on this call are a part of, but that committee is called Food is Medicine South Carolina. And Amy Weaver is the one currently convening and facilitating that group. So she is going to give an overview of that committee for everybody so that all the members are are well aware of that committee, and certainly anybody that's not already a part of it is welcome to join. Amy, thank you.
Thanks, Carrie, and good afternoon, everyone. As Carrie mentioned, my name is Amy Weaver, and I'm with the University of South Carolina SNAP Ed program, one of the program coordinators. So today I'm going to present a little bit more about the Food is Medicine Committee. So let me start by sharing my screen. Let's see. All right, bear with me, sorry. All right, oops. Okay, so in today's presentation, I'm going to share a little bit more about kind of our history, our goals and objectives, who all is involved, and our next steps and our plans moving forward. As Carrie mentioned, we do have a lot of members from the Food is Medicine Committee on today's call. So just to get started, you can see here our purpose and aims. So our purpose of convening is to improve coordination of organizations working on healthy eating initiatives in healthcare settings, as well as to identify and facilitate the adoption of state-level nutrition policy systems and environmental change strategies. So our committee aims, sorry, I have all this stuff in the way here, to develop a coordinated approach for integrating healthy food access PSE strategies throughout the healthcare system in South Carolina. So here's our timeline. As I mentioned, we're a young committee, we're less than 1 year old. So we got started in December of 2020. We had our first meeting, and this was with just the implementing SNAP Ed agencies. So that's USC, Clemson, DHEC, and the Low Country Food Bank. So as part of my role at USC, working to provide technical assistance to health clinics implementing nutrition supports on site, I knew that some of the other implementing agencies were doing similar work, and we wanted to just kind of open the doors for communication about our efforts and see where there's overlap, as well as where there's gaps and opportunities, and also to share kind of best practices and lessons learned. So during this December meeting, we decided, we would meet again in the new year, and that we also brainstormed who we would like to bring to the table. So we invited some other organizations that we knew of doing similar work. So we had a larger group, and each organization that was new presented kind of a little bit about their mission, what kind of healthy food access work in healthcare settings they're doing, and where in the state they're working. We had about 10 organizations represented, and after each organization presented, we looked at some other models, including the Massachusetts Food is Medicine state plan, just to kind of see what a food is medicine plan in South Carolina could potentially look like. So the next bullet here is February 2021 through June. So we continued meeting monthly, and each month we kind of expanded membership and participation. We decided that we kind of put the pause sort of in the middle of that time frame, and we decided that we really want to kind of formalize who we are and what we want to accomplish before bringing in other key stakeholders and decision makers to the table. So kind of in between meetings, I conducted interviews with members who represent different key sectors, and we had 2 surveys go out to all of the participating members just to kind of provide feedback on what we started discussing in meetings, kind of about our goals and our objectives. So at our last meeting, we officially decided on a name. We didn't have a name until recently. So we're Food is Medicine South Carolina, and we're now in the process of creating a logo for the group, as well as kind of developing smaller work groups to carry out the different goals that we've set. So this slide shows kind of what our goals are, and we've reached consensus on these goals from meeting discussions and from those surveys that I just mentioned. So I'll share a little bit more about each goal. So for the first one, providing resources for healthcare and community partners. One example that we've kind of brainstormed and we've started working on is a Food is Medicine South Carolina map that would include information on where to access healthy food, including medically tailored meals, food pantries, community sites that are offering fruits and vegetables, and then any sites, healthcare or otherwise, that are offering fruit and vegetable prescriptions, as well as information on where to access benefits. So there's an existing effort that started around this, and we are starting to connect with those partners so we're not duplicating efforts. And then the second goal is creating a consistent brand for Food is Medicine South Carolina messaging for all member partners. So as I mentioned, we started creating that logo, and we're thinking through, making sure that we have messaging and content and resources that are available to share as a partner. And our third goal is develop and deliver educational information to healthcare staff and patients. So some examples can include print materials and resources, as well as providing guidance for integrating education into professional curriculums, such as medical curriculums and other healthcare positions. And then the fourth one is encourage and facilitate the scaling up of food insecurity screenings and referrals statewide, with the emphasis on rural and under-resourced communities. And so we've talked about kind of having some framework guidance that we could provide around food insecurity screenings and referrals, which screening tool to use, and then also trying to figure out how we can have some kind of bi-directional piece as well. Our fifth goal is, committing to health equity by addressing structural barriers that inhibit healthy food access. So we've had a lot of discussions about making sure that we have everyone at the table who should be there. And one example is, maybe reaching out to someone with lived experience to have in these discussions, and then trying to figure out ways to, have some compensation for members as well, that would have, barriers to participating. And then, our last goal is around sustainability. So thinking about having a sustainability plan. So we've already started thinking through how we can measure success and kind of planning for the future by maximizing not only different funding sources, but pursuing different policy recommendations as well. So that's kind of a very, very brief high-level overview of what we'd like to accomplish, and hopefully that kind of gives you a better sense of where we are and what we're trying to do as a committee. So this slide here shows a list of participating organizations so far, and I've mentioned that we've tried to expand membership each meeting, but kind of put the pause for now, just thinking through trying to figure out who we are so that when we invite others to the table, we have a clear direction. So you can see there's a list of different organizations that are represented here, and it kind of gives you a sense of the different groups involved, but just keeping in mind that we do want to expand to include others in this as well. So where are we now and what are our next steps? There's three steps that are kind of outlined here. And the first one is to begin branding and develop a logo. And so we've kind of, begun the branding process. We have our name, and we decided at our last meeting that we're officially part of the South Carolina Food Policy Council. And the second one is around developing smaller work groups and subcommittees and continuing to recruit new members. So at our next member meeting, we'll be discussing work groups kind of based on those objectives that I just mentioned, so that we can really start getting to work, and then we'll continue to recruit new members, maybe including some of you here today. And then our third one is an exciting one. So receive training and technical assistance from the Center for Health Law and Policy Innovation at Harvard Law School, thanks to one of our member organizations on the Food as Medicine SC committee. We have the opportunity to hire consultants from the Harvard Law School Center this fall. And so we're still kind of ironing out the details, but we're thinking that they would provide technical assistance to the committee, most likely in terms of having kind of a one-day retreat in the fall, strategic planning kind of session, as well as some check-in consults kind of over the course of the next 12 months or so. So all this to say, it's a really exciting time for us right now, and there's a lot of momentum definitely building. And this is good timing. So our next monthly meeting is actually this Thursday. So far, we've just been meeting via Zoom, which works out really well when convening partners from across the state. So I have my contact information here if you'd like to sign up for the next meeting, or if you have any other questions, you can have my contact information here. So there's some really exciting momentum going on. And as mentioned, there's also some research that shows that food as medicine interventions are effective and they can be low-cost solutions to improving health outcomes, decreasing healthcare costs and spending, and enhancing the quality of life. So thank you for letting me present today. If anyone has any questions, please let me know. I'll stop the screen share.
Thanks, Amy. So one note about the reason that we sought out technical assistance from that center at Harvard Law School is that we've really drawn a lot of inspiration from very successful work out of Massachusetts. Their food as medicine plan there that has, led to some policy changes at a state level there. So it's exciting to have people that have so much experience in this space be able to kind of help us think through some of our work here in South Carolina. So any questions, comments for Amy? All right, so we will now move into our last agenda item where we will be able to hear from all of you all about your thoughts around committee structure. So I'm going to turn it over to Brian and Nikki to walk us through that process.
Thanks, Carrie.
Thank you.
Unfortunately, I have to run a little bit early today, so I trust that Brian is going to be fully capable. But I'll just kick things off. During one of our prior meetings, we had a great discussion about the types of potential committees that were out there. And we talked about some of the existing committees. And ultimately, we felt like it was a big conversation. There's a lot of you on the call, and it could be easier to present some live links to very brief questions so that you guys can answer the questions using a Google form survey, and we can get real-time results to kind of facilitate that conversation. So Brian, is there anything else you want to add to that?
Not so much, really. We're just going to go through the questions one at a time and give you a little bit of time to respond to them. I think this is the best way to get as much of feedback as possible while everyone is on the call. And then from there, we'll make some decisions around what the committees in the group will be comprised of. So the first question is about existing committees. And what I will do is I will just pop a link into the chat to everyone. So if you can find your way to the chat box, you'll see one there currently. And this is question 1 regarding a few committees that exist. I'll just note that this is question 1. And as you pull it up, you'll see that it says, of the following existing committees, which groups are you interested in participating in? Food is Medicine SC, which has already been spoken about today. And there is a contact there as well, and we'll shoot all that information to you again in a follow-up. But the second group is Health and Planning, and that is pending a committee lead, but you can reach out to Carrie Draper on that one. The next one is Transportation, which is also pending a committee lead, and you can reach out to Carrie on that one. And then the Anti-Hunger Task Force, which I believe, if I look further down there, that the contact is Phil, who spoke earlier. And then none of the above if you choose not to be involved in any existing committees. So as I'm speaking here, I'm hoping that everyone is pulling up that survey via the link in the chat box and responding to that as we talk here.
And, one of the goals today is really to get kind of some firm commitments. So don't feel like, I've got to select something. And when we get to the next question, I want you to really think honestly about if you had to pick one or two things to commit your time to, what is it going to be? What makes the most sense for your job and the position that you are in? Because you want this to be based on existing membership and your existing willingness, not just you acknowledging that that this is an issue that needs to be addressed. Because we really need to know if we don't have committee members that can address those issues, that we either need to recruit new membership or we need to just table that issue. And just a clarification, that last group mentioned will be a combination of the group that Phil has been hosting with the group that Appleseed is now hosting. So they have joined forces to increase the kind of efficiency there. And then I'm going to step away. I'm going to jump onto my phone and I will leave you in Brian's capable hands while I listen.
Thank you, Nikki. So in moving towards the next question, question 2 here, this is a little bit more lengthy of a question, but this is regarding potential committees or areas of interest. And as Nikki said, this is kind of a quality versus quantity thing. Please don't feel that you are required to commit to any of these. However, if there is something that you are interested in that you really do want to put a concerted effort towards and join one of the committees under the Food Policy Council, you can rate these particular items in priority. So that should be shared right now. So please do take a look at that and take a moment to click through there. I will mute myself just temporarily. I have a talkative assistant who's close by. If you have any questions, please please just chime in and I'll be able to hear them and respond to them. But this one may take a little time, so give you some time to take a look at it.
And I do, this is Carrie. I do just want to make a comment about this question. So when you all became members and you filled out the form, giving your contact information, saying, your geographic representation, your sector representation, you were also asked what you think are the 3 most pressing issues around the food system, food policy, that needs to be addressed in South Carolina. And so these options are kind of a thematic analysis of what you all put on those forms. So they're coming from initial interest from what this group and of course the rest of the members that aren't on today, but see as the most pressing issues around.
There is also a spot that remains in the second part of this question, just for any add-ons or write-ins, in case you were unable to participate in that original survey, or if there's something that you feel is missing from that boiled down list that came from our original survey. The question came up, is 8 the highest? If you actually scroll side to side, there are as many rankings or as much hierarchy as there are options. So I believe there are 11 options, 11 being the highest ranking and 1 being the lowest ranking. Okay, I think what we'll do is post question number 3 in the list. These last 2 questions are a little bit less lengthy than this one you're working on. So Those of you who have kind of moved forward and are ready for the next question, it will be available here shortly. And those of you who are still working, no pressure to rush at all. This question 3 is in regards to if you are aware of any related committees or groups that would be interested in reporting their feedback to the Food Policy Council. And then if you know of any groups that are interested in perhaps members of the Food Policy Council joining that particular group, just to please add those in. So here we go with question 3. And if there is anyone who is just joining us or coming back to us, I know a lot of times people are doing double duty. So what we are in the midst of currently is answering a few chat questions here, questions that I'm posting via Google Forms in the chat box regarding the formation of committees, some existing committees you could engage in, and then what kind of committees we'd like to form moving forward based on some feedback that we've received from the membership at large. Those are all in the chat. You can find the links. We're on question 3 currently. As you're navigating this, are there any questions at all? If so, feel free to chime in or add them to the chat box. The silence makes me nervous. Okay. Well, as we move forward here, I'll post the 4th question and final question into the chat box. This particular question is just regarding any feedback on how the committees may report to the Food Policy Council. Thus far, our format has been as such. You know, we are today taking some time out of our agenda to hear from those committee members, what they're up to, how to get in touch with them, etc. If you have any comments, question 4 here, on how that might take place or any improvements we can make to that, please do add those to this question 4. Thank you.
And Brian, I don't know the power of your multitasking right now. Do you think you are going to be able to quickly visualize the ranking of these, or is this something you think we should report back to via email?
You know, I like a challenge.
All right.
Let's see what I can do here. Let's see. Hold on a second.
Now, Brian is being a champion because I was supposed to really be running co-lead on this with him, and I'm in the car, so making that not possible.
I feel like it's my time, Nikki. It's okay. Denham's being pretty great. So looking at question 1, you know, we've got a decent amount of folks who are interested in being involved in 11 out of the 17 responses are involved in the Food as Medicine group. We have a few people sign up for health and planning. We're sort of lacking in the transportation area. I have 11 people who have shown interest in the anti-hunger task force as well. And thank you to those of you who have chosen none of the above. I appreciate that. let's see here. The next question, question 2, response is, it looks like, just one moment.
And just so you all know, if there's ever a committee that you're currently in, this is one of the questions, but just open-ended invitation. If you're in a committee that you think the members of the broader South Carolina Food Policy Council might be interested in joining, feel free to share it with us, to share with the broader leadership. We really want to make sure that you all have as much participation as possible and that there's as much connectivity as possible between the existing work. And I think that's a great example is the work of Eat Smart, Move More, and Appleseed, them coming together to join their committees. I think is a great example of trying to figure out what's the best use of everyone's time and what makes the most sense. And those things can evolve and change.
So sorting out the details from the Google form as it stands for the second question is a little bit more involved right now. It looks like we have a decent high score for food access and insecurity, and then food deserts and swamps. Let's see here. Let's see. It looks to be fairly even across the board. So like I said, I think it'll come down, this is like the Olympics, it'll come down to less than 1/10 of a point on this one. Question 3. We're hearing from groups that would like to be interested or that are interested in reporting their feedback to the full council. Mill Village Farms was listed there, who I think many of us are familiar with. That's great. And then the West Columbia Casey Food Policy Coalition, just starting to recruit stakeholders. Happy to report. And then let's see, Calhoun County Farmers Market is interested in Food Policy Council members joining their group, United Farmers USA. And then there are some of our board members who are participating in the West Columbia Casey Food Policy Coalition, as well as our group here, but there might be other members that are interested in being part of that discussion as well. As far as the last question, some of the summaries for ways that groups can report back or committees can report to the full Food Policy Council include a newsletter, which the question is, do we have a newsletter? And we do. Zach, who I believe is out on paternity leave possibly, or is unavailable right now, but he has been putting that newsletter out, I think, on a quarterly basis. Let's see. It'd be great to have some sort of brief bullet points from each committee month to month between meetings.
I wonder if we can, Carrie, do you know if that, sorry, I'm talking through a mask. Do you know if that's archived on our website? Do we archive our newsletters?
I think we do. Yes.
And then there was Google Drive with documents to share, and then making it does make sense. Someone commented to provide updates at each meeting. It doesn't have to be a lot of time, but should be a standing agenda item. So there you have it for those responses. If there are any members still engaged here that have not completed these questions and you're willing to do so, they are in the chat box. I believe we can also send them via follow-up for everyone to add their input if you weren't able to today. And we'll drill down a little bit more into the contents of those responses, provide feedback on that as well.
All right, thanks, Brian. And yes, you can find the past newsletters on the resources tab on our website.
Excellent. Well, thank you to everybody who participated in these survey questions. I hope it didn't cause anybody too much of a hassle to do so. It's, I think, very fluid for us to get that information from you, and we want everyone to be able to have some input as we move forward. So thank you very much for that.
Thanks, Brian. Does anybody have any closing thoughts or comments before we wrap up today? And reminder that our last then quarterly meeting for the year is scheduled for October 26th at the same time. So from 1 to 2:30. So make sure that you get that on your calendars.
I just wanted to add, it's great to see so many familiar and new faces that are involved in the general membership. To those folks who are engaged today, I know we all have pretty extensive networks. Please feel free to share when these are coming up, with the folks in your network, and invite them to be part of the general membership.
All right. Well, thanks so much, everyone. I hope you have a good rest of your day.
Take care, everyone. Thank you.